Welcome to Health Call, Lucas County Health Center's talk show where we shine the spotlight on the services, providers, and staff who play an important role in the care we give. We'll introduce you to our team, talk about what you can expect from your care, and share moments that make us proud to be your healthcare provider of choice. Today I'm proud to welcome our Wound Care Services Manager, Paige Nelson. Welcome and thank you for joining us today, Paige.
Thank you for having me today.
You bet. I've got a couple questions about wound care. But first, can you share a little about your background and what drew you to Wound Care Services?
Yeah, I'm a registered nurse. I went to school at Mercy College in Des Moines for my RN. And so I've been a nurse now this will make my 15th year.
Yeah.
9 of those years I have spent here at Lucas County. Prior to that, I was working at Mercy Hospital on their acute care and cardiology. So I've since been here, done wound care, and started in a position where I floated everywhere, did a lot of things in the wound care, and after some time have grown to love wound care and have a pretty good passion for it.
Well, tell me about wound care. You know, what is exactly wound care?
So it's where we see patients who have chronic wounds that just aren't healing, given 4 to 6 weeks, something's still not healing correctly. So then those are the patients that we see, and we try to determine the cause, contributing factors to those wounds, and implement a plan to heal them.
So what would a typical day be in wound care?
When we first see a patient, the nurses, we initially, very first visit, we take a thorough history, go through nutrition, all kinds of things that we review and assess. Then with each visit, the nurses will look at each wound. We do measurements, we take pictures, we compare those from week to week, and then the doctor comes in and takes a look at things. He compares things as well. Doctor comes up with a plan of treatment, and we then put on the dressing, do the education that needs to be done, whether that's going to be home dressing changes for patients or whether patients are coming back to us for those dressing changes. And then we'll, discharge the patient for the visit and continue to follow up as the provider would like to see the patient.
Sure.
Yeah.
Paige, what sort of technologies and kind of different, care do you employ to ensure that you have success?
Well, that is individualized for each patient. So depending on the type of wound, the severity of the wound, the doctors then take a look at those things, and we have a multitude of different dressing types that we can use. We have advanced things also that we can use as like skin substitutes that we place on a lot of patients. We have things such as a wound vac, which is a vacuum that can help to heal wounds. All of those things are things that we commonly use back in the wound clinic, but they are completely individualized per the patient and
That's
the wound
amazing.
type.
That is amazing. So how do you all stay updated on the current procedures and techniques that come in wound care?
So a lot of things stay the same. So some of the treatments don't change necessarily, but we do constantly continue education, whether that's through, reading articles, going to some classes, taking online classes. The providers go take wound care classes as well to help stay up to date on things like that. So,
Sure.
Yeah.
All right. I personally know that there's been a lot of success stories with wound care and all the work that you're doing back there. Can you just share one?
We just recently had a patient with a video, so we have a video on one of our recent successes.
Well, let's look at the video.
What I discovered was in Sheridan, Iowa, empathy with efficient, educated medical healthcare professionals created something that turned my whole world around. And I mean that in every sense of the word. You have to understand where someone's coming from them in order to treat them. It's an environment that is small enough you have that personal touch, but the efficient manner in which Paige and Dr. Sundquist and the whole team created was something that turned the thing around. Paul Harrison, I started 2023 with stage 4 kidney cancer that went undetected long enough that it actually had transferred to my lungs, and we were worried about it going to my brain. On February 15th, I had a kidney removed and a surgery that went bad. A couple weeks later, I sneezed in high V and had a hole the size of a golf ball in my incision. That same surgeon did an emergency surgery that also went bad, ending in an infection. You're hit by two sides. The surgery went bad, everything's delayed. I was told going in, we got to get this done fast so you can start the treatment because my cancer is growing quickly. So in my head, I keep hearing those words, your cancer is growing quickly, but we can't do anything until you're healed. Well, prior to walking in the door, I wasn't healing, I was going the other way. I'd never heard of a wound specialist as the title before. It's either a doctor or a surgeon or something. I'd never heard of that till I came here.
The wound clinic is there for, anybody that has a chronic wound. We see a lot of diabetics, we see a lot of people with vascular disease, but it's really anybody that's got a wound that's long standing and isn't healing properly. Because that's really what it's all about, is trying to figure out, what's causing this and how do we fix it.
A lot of people have never been to a wound clinic to be seen or treated for something like this. So most of it would be nervousness, anticipation. So we just try to put that at ease within the first visit, let them know how things are going to go, and, work with that.
No appointment, no nothing. I just walked in the door at 5:30 in the morning. It said, here's my problem, and I showed them what we were dealing with. They jumped on board. From the first nurse I met with to the on-call doctor overnight to, I actually was lucky and just really lucky that Dr. Sundquist, the wound specialist here, happened to be on duty that morning, and he was the first person I seen, and frankly, that was the turning point.
With my background in trauma in the military, served 3 different combat tours. I've seen several wounds that were, needless to say, large. So having dealt with large wounds in the past, I have enjoyed thoroughly working in the wound clinic. It has been a good environment. I love doing procedures, and it keeps me in touch with patients that are in need. Everybody growing up has had a scrape or a wound at some point, and it always heals. Where, these people that come into the wound center, they sit there and stare at a wound for months and it doesn't heal. So, a lot of them are in panic mode at that point.
I went from hopeless and pain, couldn't really function at all. I went from not being able to do anything to suddenly feeling good enough to start doing stuff. Literally a couple weeks later, I was mowing pastures on the tractor and stuff and feeling like I could do something again. Now I got a ways to go in this cancer battle, but I ain't been in a recliner waiting to live or die, except for the couple hours I spend in their recliner every couple weeks getting an infusion. Again, using the analogy of as a mechanic, anytime that you work on something someone else did before you, that's a challenge. There wasn't even a hesitation. Just figure out where we're at and move forward. And we've done that. I'm a small town guy. This is my world. I love small town. I love knowing everybody in the infusion center. I know what their hobbies are, how their family's doing. That's important to me. But I also think there's a stigma out there that people think if you go to a small town hospital, you don't get big town service. Well, I got more services here in a more efficient manner than I've ever received anywhere, ever.
Rural access hospitals, by far, have a better patient relationship than a larger institution. Patients learn to trust you because they know who you are. They build a relationship with you because they're your neighbors. They don't trust going to a hospital sometimes, so they want to trust you as a person.
I mean, I was talking about mini Holstein cabs and skid loaders with Dr. Sundquist, mainly because I was using an example like I just used with you. I trusted him just simply because of his answers. He took the time to explain to me what we were going to do, why we had to do it. I think that's huge.
I just think the care that you get here and that we get to know our patients on a one-on-one basis and really work together with them to accomplish our goals, heal their wounds, it's pretty special.
You know, I'll do anything I can for the patient. I try everything. I exhaust every measure that I can in order to get them healed. And like I said, you know, our success rate is very high. Some people take a little bit longer than others, but for the most part, you get people healed.
Being able to help someone attain closure and the satisfaction that they get out of it is all rewarding.
I want Lucas County Health Center's Wound Center to be known that we are here, and when people hear about it, I want them to know that good things happen here and it's not scary.
What drives me, I mean, I think it's a tough system to navigate for most people that need it the most. It was just important to me I did something to make sure that the next person can receive the same, and the next person, and the next person. The level of treatment on every level efficiently that I got here was, it's unbelievable. People need to know that.
You know, that's just amazing. Thanks for sharing that video. I really appreciate that. You know, as we wrap up today, what information would you have for, you know, our potential patients that would seek wound care services?
Yeah, if anybody has a long-standing chronic wound, something that's not healed within 4 to 6 weeks, I advise them to see their primary care provider and kind of talk about what further steps can be taken.
Sure.
We do take self-referrals, but ideally we want to have a baseline too with some knowledge from that provider, that primary care provider as well.
Okay, very good.
Yeah. And then you can just call our office to get something scheduled.
All right. Well, Paige, I want to thank you for, you know, being here and being our first guest. That's, you know, pretty awesome. So, and, you know, for all our viewers, I want to thank you all for joining us too. We hope you'll join us again next time as we meet with our surgery team and give you a walkthrough of what to expect when you come to Lucas County Health Center for a surgical procedure. We'll cover everything from checking in to discharge. If you found this episode informative, don't forget to hit that like button and share with family and friends and subscribe to our channel. And thank you again, and we will see you again soon.